When you think of media titans, you might think of Lord Beaverbrook or the Washington Post editor around the time of the Watergate scandal. Or you may think of Anna Wintour, of Elle, or Vogue. But the biggest media titan of our age is Alastair McLellan. For significant numbers of years now, he's been the editor of the HSJ. He's overseen a print magazine to go fully digital. HSJ Awards, HSJ Intelligence, these are things that people make our NHS tick. And no one has seen it, been there, done it as many times as Alastair McLellan. And it's my great privilege now to invite him to the stage to share his thoughts. Alastair, thank you.
Thank you, Glenn. The cheque is in the post. Right, yes, I've done this job. My career plateaued very early. I have been doing this job for 23 years. But I've not really seen anything to compare with the last 2 months. Bloody hell. It always amuses me. Governments come into power and they say, we will not be doing a top-down reorganisation. We have learned the lessons. We will not be doing what they did, confusing the NHS, wasting all the money, redundancy, blah, blah, blah. One thing we can promise, we will not be doing a top-down reorganisation. It's exactly what Wes Streeting said in the running up to the election. And then, of course, they get in power and they try and start doing stuff. And it's all really hard, and well, why does it work like this? And that's just stupid. And they get to the point where they go, oh, let's just, how difficult can it be? Just get rid of that lot, then we can just do this. And hey presto, top down reorganisation. 'Twas ever thus. But there are ways of doing top-down reorganisations, and what the government has embarked on, this top-down reorganisation. It makes the Lansley reforms look like the Marshall Plan in terms of, they have no plan. They are absolutely making it up as they go along. It makes for great press. We've tracked traffic to hsj.co.uk since 2017. 7 of the 10 busiest days that we've had on HSJ have been since the start of March, which I think probably tells you the level of interest. Anyway, let's just review, because a lot's happened, so let's just review. You'll know this, but let's just sort of set it up. So, NHS England to be absorbed by the Department of Health over the next 2 years. Almost complete replacement of the NHS England top team with a new group of leaders. The size of the centre to be significantly reduced. And the running costs of integrated care boards to be cut in half by October. So, there's the headlines. What does that mean? Well, it means that the experiment of running the NHS via an independent arm's length body is over. We're not going to do that for at least another decade or so. The politicians are back in charge. The politicians and their advisors are back in charge. It's back to the noughties, if you like, and beforehand. ICBs, there are going to be a few of them. There's a piece published by my colleague Dave West this morning in which we basically try and make an educated guess to the number of ICBs, and the number we come up between 23 and 28. And obviously, there'll be fewer of them, whether they're officially merged or just consolidated in shared leadership, who knows, but there'll be different things. But more importantly, their focus is going to be narrowed. So we know they're not doing performance management, so they're not the bosses of the providers anymore. They are supposedly going to be doing strategic commissioning. Nobody knows what that means. They don't, trust me. Nobody knows what that means. It just sounds good. Providers are very much in the ascendant now. The pendulum has swung back. Just need to look at the NHS England top team. The new direction is towards accountable care models. In other words, providers being given a budget for a population and then rewarded, etc., against outcomes related to that population. How we will exactly get there are many routes, and there'll have to be something else in plan because not every part of the country is ready to go to in fact, most parts of the country are not ready to go the ACO route. Systems, so for the past 7 years, something like that, it's been system first, organisation second. Not anymore. Now it's organisation first, system second. The message has gone out very clearly to trust chief executives. The best thing you can do for your system is to make sure that your organisation functions as well as possible. So, don't go to the provider collaborative meeting. Don't go to the ICB meeting. Only go to those meetings if you've sorted out all your problems in-house. And I want to be, because it's sort of, everyone says, system working, it's apple pie motherhood, and the NHS loves apple pie motherhood. But the instruction is very, very clear. So that's why only people like me will say these kind of things, but trust me, the instruction is sort your own stuff out. If you sort it out, then maybe talk to your neighbours about how you might mutual aid and all that kind of stuff. Then, if that's all right, then look to the system. But the focus, at least for the next year to 18 months, and I never look further than that because it's pointless, is very much on that focus. What's not changed? Well, for a start, there is no more money. In fact, there's less money. Because, nothing to do with the NHS, but because to do with Vladimir Putin and Donald Trump and other related issues like that. Elective care is still the only real priority in the next sort of year to 18 months. You'll hear talk about other stuff, but really it's only elective care. The 3 shifts, everyone know what 3 shifts are, hospital to community, digital, analog to digital, treatment to prevention. They're still very much the government's ambition, but that ambition is increasingly sort of going out. And when they announced the 10-year plan, I think the original idea was that the 10-year plan would be basically front-loaded. It would have lots of things we're going to do in the first parliamentary term, and then some aspirations for a second parliamentary term. It might still be presented like that, but I think what you'll find is that the meat of the 10-year plan has been pushed back to the end of this parliamentary term and next parliamentary term. So the big changes that we might have been suspected, for example, a radical changing of financial flows, so money flowed into the primary and community sector by default. I think that is going to be pushed back to sort of 28, 29. They will present it as a big change. But I think when we study the detail, we'll see that actually a lot of it is 2 or 3 years away. And the period 25-27 becomes a transition period. Sort of like the period we had with STPs before ICBs. Of course, there's lots of danger in that approach, but they don't have the money. They've not really got any choice. I think that because of these external factors, the hopes that people in the Department of Health and elsewhere had that they might be able to give quite a bit more money for the NHS in the spending review in the summer, that's largely gone out of the window now because just there isn't the money. They've got to spend more money on defence, tax takes are down, etc., etc. So what comes next? Well, we're promised a financial reset. What does that mean? So basically, Jim Mackey, Glenn Burley, etc., basically thinks that the way money is flowing through the NHS has become much, much too complicated. It's full of, bribes and penalties, basically. And actually, what they really want to do is say, here's your money, it's all your money, you're not getting any more money, but we're not holding anything back, and, live within your means. That's the approach. It won't be as simple as that, but that is much more of the approach. We are promised a new operating model, which will define particularly what the roles of ICBs will be. I mean, it's been like, it's coming, but it keeps getting delayed, and it keeps getting delayed because they keep going, what are we going to do with continuing healthcare? That's 6 billion quid, Really? Oh. And those kind of conversations are happening a lot. What are we going to do with procurement? We've decided that we're going to centralise procurement at ICB level. Have we? Yeah, that's what we're doing. Oh, what are we going to do it now? We're going to take it to regional level? I don't know. Who knows about procurement? Anyone here know about procurement? That's the kind of conversations that are going on at the moment. We will see a UEC plan, which might have something interesting to say about financial flows, moving towards a more sort of, activity-related payment. We'll see integration. The integration plan for NHS England and the Department of Health will come out. It's supposed to be by tomorrow. It won't be by tomorrow. It might be by the end of May, which will give us a bit more view of what's happening in regions. And as I say, we'll see consolidation of ICBs from 42 to our best guess 23 to 28. So I suspect I don't really have to tell you this, but this creates. What's being done and the way it's being done has created an awful lot of risk. It's very distracting, it's very disrupting. There's very, very few people in the NHS at the top of the tree who haven't lost their jobs, are losing their jobs, have a new job, or work for a new organisation or a new boss. And that's almost everybody. And if you sort of wanted to create an environment in which people found it hard to focus on the day job, that's pretty much what you would do. And of course, therefore, it creates loads of uncertainty. I've mentioned a few things that the answer is still unclear. And I could mention many, many more. Because of the uncertainty and because of the macroeconomic picture, we'll see more caution. There's plenty of caution already, of course, but there was even more caution on spending, I think. And of course, it's just going to take much longer to get decisions made about everything. There are plenty of issues. I don't need to tell you about them. there's a lot of change in procurement going on at the moment. I mean, we were halfway through a big reform process, then Jackie Rock left, and now where are we, and etc. There's lots of unanswered questions around procurement, full stop, before you chucked in all of what's happened. Let's try. It's difficult for me as a journalist, but I will try. Let's try to end on a more positive note. We are promised a new approach to capital, which may underlined many times, that the NHS can get on with building and buying things more quickly and more effectively. We shall see. We are offered, under this sort of financial reset idea, a sort of clearer set of rules of engagement. Who's in charge of what, Less of this sort of system, everybody has to get into a room and sort things out type approach, and more, you're in charge of that, you're in charge of that. And related to that, fewer decision-making layers. So, performance management, for example, won't be, this sort of great long list of people sitting around a table. It will be a direct conversation between NHS England and the provider concerned, in theory. Priorities, where they exist, will attract investment. Elective care will attract investment. Community diagnostic centres, surgical hubs, etc. Technology, you'll hear from Ming Tang later. Ming, if you ask her, will tell you that if it's an EPR, an FTP, or an app, it might get some money. If it's not one of those things, it won't get any money. Or not from the centre at least, and not for the minute. Okay, so my 15 minutes is up. I could go on. I'm afraid I can't be with you for much. I'm doing the next session, but then I have to head off. My colleague Jack Searle, who's our procurement correspondent, the only dedicated NHS procurement correspondent in the world, is with you today. Are you here, Jack? There he is. Look, they're waving back. There he is. There we are. That's right. He does look exactly like Chris Searle from That's Life, because he's Chris Searle's son. That'll date you all. Anyway, so Jack is around for the entire conference. Please ask him any questions that you might have, and any ones that he doesn't know, and he knows a lot. He will bring back to the rest of the team. So there we are. We've finished. We haven't got any time for questions, but maybe we'll discuss that in the next panel. We'll discuss some of them in the next panel. I think, in summary, what I would say is we now know less about how the NHS is going to be run than we did when this government was elected almost a year ago. It is a time of considerable uncertainty, and that uncertainty is not going to lessen for the foreseeable future for a whole range of internal and external things. Not really for me to offer experts like yourself advice, but would I be, if I were asked to it, I would say that, this is the time to be really connected to what's going on and to not make assumptions about things, because almost all of the, or many of the assumptions that we were all operating on, including me, my job is to know what's going on, have been blown up in the last 2 months. Right, thank you very much. Let's move on to the next panel. My speakers up, please.